thank you so much for having me. I'm excited to be here. I was excited to be invited again to be part of the Calgary Fermentation Festival because this is such a fun event. And I'm going to talk about going really deep into sort of the geeky stuff because we're going to talk about the science behind all of the psychobiotics, microbiome. We're going to talk about how it connects to brain health and mental health. And it's a really exciting topic because there's a ton of research on this topic. And I had originally, so I'm reusing this topic. To be honest, I originally did this presentation to a bunch of doctors. And anytime you do a presentation to a bunch of doctors, everything has to be really fully referenced. So everything I'm saying can be backed up by research. So anyone who says that, oh, like all this stuff that you guys are doing is pseudoscience, it's not backed by science, I can tell you that everything I'm going to be presenting today is all backed by science. Okay, let's figure out how to get to the next page here. So this is a little bit about me. As Malcolm has already announced, I run a clinic called Advanced Naturopathic Medical Center. It's in Market Mall Professional Building. It's on the second floor there. And I've been in practice for 17 years now. So been doing this for a while now. And so let's talk a little bit about this connection between mental health and gut health. And according to the World Health Organization, major depressive disorders is the leading cause of disability. And if we look at Canadian statistics, we're seeing depression, anxiety, mental health issues as 1 in 5 people are affected by mental health. And what's interesting is, we start to hear a lot about comorbidities, but what we're seeing in terms of comorbidities is that we'll see anxiety, depression, and mental health issues, and we'll often see it paired with chronic gut disorders. So people who have any sort of mental health will also typically also have some chronic gut disorders. And it's really interesting because I saw this in my practice in that I had a patient who came into my clinic and he had anxiety, he had OCD, but what he also had his entire life was gut issues. And that's what brought him into my office, was to work with gut issues. So I said, I don't really work with OCD. It's not really my area of expertise, but what I can work on is gut health. And I know that there's a big connection between gut and brain. And we worked on healing up his gut. And what we saw is that his gut health improved. But what he also noticed was that his anxiety he wasn't having panic attacks. So his anxiety also improved and he was having less incidences of OCD. So we do see this connection between gut and brain. So even as we heal the gut, we're also helping to affect the mental health. And just to add in a little statistic in that, what we're seeing with what's going on with COVID is that we are seeing more people having mental health issues. So when they did a survey of if people were stressed with what was going on with COVID, they had close to 50% of adults were saying that they were experiencing mental health issues due to COVID. Now, what was discovered a number of years ago was this gut-brain connection. And what they found was that it was a bi-directional communication. So we often think that the brain is the one that controls everything. So so we have a top-down connection between the gut, so the brain controlling what's going on in the gut. But what they found is that there's also a bi-directional. So what happens in the gut is also communicating to the brain. So there's that bi-directional communication between what's going on in the gut and the brain. But there was an interesting piece that was missing in that gut-brain connection. And that interesting piece was that the gut microbiome is critical to the normal function of that gut-brain axis. So then what they did was they renamed it the microbiome gut-brain axis. So they added the microbiome into that gut-brain connection. And what we found is that, there's a number of ways that it's connected. And I'm going to go through all of those ways. It's connected through the immune system, the neuroendocrine system, through the HPA axis, through the autonomic nervous system, through the central nervous system, the vagus nerve. So there's lots of great connections. So there is physical and biochemical connections between the gut and the brain. One major one is that microbiome. So our brain is actually dependent on these gut microbes to actually make some of those metabolites for proper brain function. There's a connection between the gut and the brain through the lymphatic system, and I'm going to explain that. And through something called the glymphatic system, there's a connection. There's that physical connection between the vagus nerve and the gut, and we see that that's one of our cranial nerves. And then we also see it through one of our through the central nervous system. It's called the enteric nervous system. And these are the nerves that are actually embedded into the gut wall. Then we'll see neurotransmitters. I'll talk more about that, as well as the HPA axis, which just talks about more of that stress response. So now we talk about something called the psychobiome. Sounds a lot like the microbiome, except the psychobiome has been shown to affect, it's really the microbiome that has been shown to have an effect in terms of mental diseases. So it's just showing how the microbes in our gut are actually influencing what's going on in terms of that microbiome. And so because it's influencing the brain, it's also been named the psychobiome. Psychobiome is, it also needs to have lots of diversity. It has a profound impact in terms of our brain function. The brain needs certain metabolites from that psychobiome in order to properly function. And the psychobiome, just like that microbiome, also needs to have diversity, and then it also needs to have balance, and it's dynamic. It's affected by a number of different factors. So what researchers have recently coined is this term called psychobiotics. And the psychobiotics, what they are is they are live bacteria that have been shown to be beneficial for mental health, including brain health. And so there's a number of different live bacteria that have been studied, and they have been named in the research called psychobiotics. And again, these psychobiotics, they're manipulators of the psychobiome. And what's interesting is that they will actually regulate how our immune system functions and help to actually decrease inflammation in our system. So I'm going to go through some of that research too. And then this is a list of a number of the different psychobiotics that have been researched. And it doesn't mean that there's other microbes that are out there that may also have psychobiotic effects on the body. It just means that these are the ones that have been researched. So the main ones that have been researched are the bifidobacterium and the lactobacillus, those families of bacteria. Now, one of the major connections is the lymphatic system. And the lymphatic system is, so we have about 70% of our lymphatic system was within the digestive tract, and it is called our gut-associated lymphoid tissue. And what it is that lymphatic system is just on the, it's in our gut, just on the other side of that, that lining of our digestive tract is a big part of our, it's a bunch of our immune system, and that's where our lymphatic system lives. So about 70% of our lymphatic system is accessed on the other side of that lining of our digestive tract. Now, they used to think that the lymphatic system went throughout the entire body, but that it didn't go throughout the brain. So this is the one. Can I point here? So this is the original one that they thought that the lymphatic system was. But then what they discovered was that that we actually have vessels within our brain. So the lymphatic system is actually draining the brain. So we actually have brain lymphatics. Now, what this means is that if we have a compromised gut wall, so if we have, what can happen over time is that we can have inflammation in the digestive tract. We have damage to these proteins that hold the cells of our digestive tract together, called tight junctions. We have injury to those tight junctions. So then food that's not completely digested can end up in our lymphatic system. And when it's in our lymphatic system, it causes a whole immune response. And what can happen is that this inflammation can actually cause inflammation within the brain. So we have a direct access point to the lymphatic system through to the brain through the lymphatic system. Okay, and then there's these things called endotoxins. And endotoxins, what they are is they are just breakdown products of the healthy gut bacteria that, that they're able to measure when they're doing research and studies. Like when I was going through school, we called this leaky gut. But now it gets, when you read through the literature, it gets fancy names like bacterial translocation. So it just means that the bacteria that should be part of our gut is now in our bloodstream or in our lymphatic system or in our brain tissues. So what they're finding is that we have these endotoxins, which are measurable substances that are translocating to other areas of the body where they ideally shouldn't be, which is evidence that we have what we'd call a leaky gut picture. So understanding how the lymphatic system drains is really important, because what the lymphatic system is it's cleaning up all of our tissues and moving toxic loads out of our body. So it's cleaning up all of those extracellular space in all the different systems of our body. Our body will then, we have our superficial lymphatic system, which drains the head and neck, which includes the brain. Will also include our skin, breasts, everything superficial. And then our superficial lymphatic system drains into our deep lymphatic system. So our deep vital organs. It filters through the liver and empties out the colon. So I always think of it like a funnel because it's a closed system. So if we have, for example, if we have constipation happening, it backs up that funnel. Or if we have a congested liver, it backs up that system. Or if we have imbalances happening in terms of the digestive tract, it backs up that system. And then what happens is that that superficial lymphatic system can't properly drain and clean up those tissues. All right. So what we see is that if we have a compromised gut wall, increased permeability of that gut wall, we see that, whoops, going forward too quickly, we see that in patients who have depression. So, and we also see an increase in that bacterial translocation. So we also see an increase in terms of, I talked about when we have that compromised gut wall, it activates the whole immune system. And so you're able to actually measure all of those immune globulins and like those bacteria, as well as all of those biomarkers of inflammation. And we see those are high when someone has clinical depression. And what we see is what they've shown in some of the research is that when you give someone some of those psychobiotics, we see that it helps to modulate the immune system, it modulates inflammation, and it's actually able to reverse that bacterial translocation. So when you're saying that, what it's helping to do is it's actually helping to heal up the lining of the digestive tract. And by doing that, what we see is that on a clinical level, is that it improves depression and anxiety. So it's actually, so what we see is that those psychobiotics, by improving the gut health, is actually improving depression and anxiety outcomes. And, you know, we continue to see this in the research, is that with depression, you get chronic low-grade inflammation, and you see a lot of those biomarkers of inflammation showing up. And what they've shown is that if you give someone some of those psychobiotics, that it decreases the inflammation and decreases a lot of those pro-inflammatory cytokines. And what's interesting is that it's also been shown to alter the tryptophan metabolism. And I'll talk a little bit more about that, because that's really interesting that it can alter that tryptophan metabolism, because what we're going to talk about later is how tryptophan is actually, we need that tryptophan in order to manufacture the serotonin, and serotonin plays a big role in terms of mental health. So the research continues to show we supplement with some probiotics, often called psychobiotics, from the families of the bifidobacterium and the lactobacillus families. It helps to restore the integrity of that gut lining, and it helps with that leakiness of the gut. And the other thing that's been shown to help with that is something called NAG. So it's N-acetylglucosamine. So it's actually a structural building block that helps the body to be able to repair those tight junctions of the lining of the digestive tract. And the other way that we can actually improve the integrity of that gut lining and help to support the immune system is using an organotherapy, which is the Byers patch. Byers patch is part of the gut-associated lymphatic tissue, so the GALT. And by giving someone some of that organotherapy, it helps to re-educate their digestive tract to be able to have their immune system react appropriately. Now, here are just some tactics that we can use to help activate the deep lymphatic system. One is jumping on one of those mini trampolines. If we can do that for 10 minutes a day, it's going to be beneficial for us. Doing strenuous physical activity that leads to sweating, so you have to do it more physical movement. Castor oil packs has been shown to also help to benefit the deep lymphatic system. Doing dry skin brushing. Infrared saunas have been helpful for moving the deep lymphatics. And within my clinic, I have some new technology called the Flow Presso, which also helps to move the deep lymphatics and drain that system. Now we get into another thing called the that helps to protect the brain, which is the blood-brain barrier. And the blood-brain barrier is really important for helping to protect the brain and the central nervous system. And what's interesting is that for us to have a good, that blood-brain barrier to have good integrity, then we actually need a really strong gut microbiome. What they've shown is that in babies, even when the baby is in the womb, when it's a fetus, that as that blood-brain barrier is actually developing, that it's the way it develops, it's really influenced by mom's, the maternal gut flora. So this makes it really important for mom when she's pregnant that she has a really balanced gut flora, because it's going to help to improve the integrity of babies' blood-brain barrier, which is going to protect their brain and help their brain to function better. So this is, I think, really important to understand of how important this gut flora is to the brain development. Now, what's interesting to me, I found this really interesting, is that if you actually look at the blood-brain barrier, it's also just one cell deep. And what holds those cells together are tight junctions, just the same way that we have that lining of our gut. That's the same way that that blood-brain barrier is. And that's your protection to the brain. Now, what you can see here is one of the challenges is that we have the compromised integrity of that gut lining. So food that's not completely digested, that's in the lumen of the digestive tract, can now move through the lining of the digestive tract and can move right into the bloodstream, elicit a whole immune response. And because it's in that bloodstream, it can move into that blood, and that blood will circulate throughout the body, including the brain. And then if we have some toxic loads, some of that toxic load can actually damage the tight junctions of that blood-brain barrier and then gain access to the central nervous system. And so this is again another connection between what's going on in the gut and what's going on in the brain. So we get into something called the glymphatic system. And the glymphatic system is the glial lymphatic system. So the glymphatic system is the fluid that's within our brain and within our spinal cord, called the ambionic fluid, the cerebral spinal fluid, sorry. And the cerebral spinal fluid goes throughout this whole central nervous system. And what can happen is that when we don't have proper flow of that glymphatic system, then we start to see things like depression, migraines, MS, Alzheimer's disease. Because what they're finding out is that when we have proper drainage of that glymphatic system, it actually helps to clean up the tissues of the brain and move things out of the brain, like amyloid plaques. So amyloid plaques have been shown to accumulate in people who have Alzheimer's disease. And when you have good glymphatic drainage, then it actually cleans up those tissues. So what they've shown is that the glymphatic system, during our deep sleep, we have a decrease of blood flow and an increase of cerebral spinal fluid. And what happens is that when you have that increase of cerebral spinal fluid, it actually flushes over the entire brain tissue and helps to clean toxic loads out of those tissues. And so this is a huge connection between lymphatic system drainage and deep sleep. So this is why what we need to do is we need to improve the amount of deep sleep we have. And by doing that, we'll be improving lymphatic drainage. And for that, we'll be preventing things like Alzheimer's disease. So some of the ways we can do this is good sleep hygiene. So going to bed and waking up at the same time, sleeping in that pitch black room using blackout blinds or an eye mask, sleeping in that quiet environment, making sure that the temperature of the room we're sleeping in is slightly below room temperature. So either having no screens, no technology 2 hours before bed, or using something like blue blocking glasses. Another thing that's been shown to improve deep sleep is to stop eating 3 or 4 hours before bed, stopping caffeine around 2 p.m., and having a soothing night routine. And then what you also want to be doing is trying to aim for about 7 to 9 hours in bed. And so that's as an adult. So, and the connection between that lymphatic system and those psychobiotics is that they're showing that when you take those psychobiotics, that it actually helps to, it helps with that restoring that permeability of that blood-brain barrier. So any sort of damage that happens to that blood-brain barrier, it helps to reestablish that and bring down the inflammation in the system. So some of the ways that we can address this and help with lymphatic system and helping to dissolve some of those amyloid plaques would be to do things that help to increase deep sleep. So melatonin and magnesium have been shown to increase deep sleep. Doing things like ginkgo helps to increase the circulation in the brain. Taking things like proteolytic enzymes helps to break down some of those amyloid plaques. So taking those before bed. There's remedies that help to improve the lymphatic drainage, including the lymphatic system, and then also adding in some of those psychobiotics, which have been shown to reduce inflammation and decrease that permeability of the blood-brain barrier. And one of the other major connections between the gut and the brain is the vagal nerve. And the vagal nerve is one of those cranial nerves. It comes down from the brain, down the side of the neck, down the front of the thorax. It bisects through our diaphragm, and then it supplies all of our digestive organs. And it plays a huge role in terms of our autonomic nervous system. So that autonomic nervous system is that nervous system that runs in the background. We don't consciously control it. So there's two parts to that nervous system. There's your stress state, and then there's your rest, digest, and repair. So the vagus nerve plays a huge role in terms of actually a physical connection between the gut and the brain. And what they've shown is that if we have an infection going on in the gut, that we can see anxiety-like behaviors happening. So there's definitely a gut-brain connection, and it's usually activated through the vagus nerve. So ways to stimulate and affect that vagus nerve is doing cold showers. Most people don't love them, but it's definitely a great way to stimulate that vagal nerve. Singing or humming helps to stimulate it. Gargling, laughter, which is something we do a lot in this place here. and then I have a machine in my office too that's been shown to help stimulate that vagal nerve called PEMF therapy. And then we have another connection through that shows that gut-brain connection, and that's through something called the enteric nervous system. So this is nerve roots that come from the spine, and then they're embedded in the wall of the digestive tract. And within that wall is different nerve cells, and they're part of the enteric nervous system. And then embedded in the walls of the lining of the digestive tract are these specialized cells called enterochromaffin cells. And these cells are actually where 90% of our serotonin is actually contained. So the reason this is important is that serotonin plays such a big role in terms of how our nervous system functions. And it's really interesting. So remember, our digestive tract is just one cell deep. So it's on one side of that cell, it's able to communicate with those microbes that are in part of that lining of the digestive tract. So we got those microbes on one side. And then on the other side of those cells, what we have is we have those nerves. So we have nerves that will attach to the vagus nerve, and that'll go right to the brain. And then we also have these nerves that'll attach to the enteric nervous system, which will go to the spine and then to the brain. So this is attached to the central nervous system. So we have a network of communication that can happen, first of all, from a physical and a chemical level, through those enterochromaffin cells. And why is serotonin important? It's a very important neurotransmitter, but it plays such a big role in helping the brain to regulate moods. It plays a big role in terms of our sleep-wake cycles. And I talked about that tryptophan, is that some of those microbes within the gut are helping to make tryptophan, and tryptophan is essential for being able to make serotonin. So those microbes within the gut are really helping our bodies to make neurotransmitters, which travel to the brain and have a huge effect on how that brain functions. Now, what they show is that the gut, and so this is talking about how those gut bacteria, that they're able to manufacture some of that tryptophan. And when it does this, when the gut is colonized, it actually helps to increase the amount of serotonin our bodies are able to make when that gut is in better balance. And there's some bacteria, some of those psychobiotics, which are actually able to increase the amount of tryptophan that's made in the gut, and then we're able to make higher amounts of serotonin. And then we get into another aspect, another connection between the gut and the brain, and that's with something called the HPA axis. So that's the hypothalamus pituitary adrenals. And this axis is mostly a hormonal based axis, but it's an axis that gets activated with stressors. So those can either be physical stressors or they can be psychological stressors. It doesn't matter which one. What will happen is that when that's activated, that will make something called cortisol. And what we'll see is that we can have, when we have an imbalance in that gut flora, that can actually increase the cortisol in our system. Whoops, I think I'm moving back. Okay, so what we see is that when we have increased activity of that HPA axis, so we have elevated amounts of cortisol that's happening, it can negatively affect how the brain functions. And we also see this, this elevated activity of the HPA axis in depressed patients. And what happens, and we see this in animal studies, we also see this in human studies, is that anytime we have stress, we actually have a difference in that microbiome. So when they compare a control group that hasn't been stressed, and then they have a group that is stressed. The stressed group have a very different microbiome than the unstressed group. So stress has a huge effect in terms of the composition of that microbiome. And, I found this interesting too, is that when our intestinal bacteria is actually being colonized, it's actually colonized at the same time that our stress response is happening. So if someone is stressed early in life, it will actually change the composition of their gut microbiome. So so in this rat study, when they separated the rats from their mothers, then they actually had it changed the composition of their gut flora. And that actually lasted them an entire lifespan. So we realize how significant those early years are in terms of developing and making sure that we have a good, healthy gut flora. And a positive thing in that, because sometimes people are like, well, sometimes you can't control what happens in those early years and that early stress, is that they've shown that if they gave, and these were animal studies, if they gave them some of those psychobiotics like the lactobacillus and the bifidobacterium, it actually reversed a lot of those changes that happened to that gut flora. So we're able to reverse any of that damage. And again, we see that happening over and over again in the studies. And so when we see that there was an increase in that HPA axis and the rats were showing anxiety related behaviors, they were able to reverse it with the psychobiotics. The psychobiotics were able to down-regulate that HPA axis, and it actually also reduced intestinal permeability. So it actually helped to heal up the lining of the digestive tract. And then on a clinical level, you also see a reduction in terms of anxiety. So different ways that we can support that autonomic nervous system, not just with those the psychobiotics, is that doing meditation, deep breathing exercises, massage, yoga, those are great ways to just support that autonomic nervous system. And then there's this thing called brain-derived neurotrophic factor. And brain-derived neurotrophic factor is like miracle grow for the brain. So what it helps to do is it helps to promote the growth and development of new neurons, and it'll also help with the survival of the existing neurons. We often associate the brain-derived neurotrophic factor with neuroplasticity. So when you're learning something new, when you're trying to create memories, and what they've found is that BDNF actually gets reduced, and it's reduced in anxiety and depression pictures. And what they've shown is that the psychobiotics have the ability to be able to upregulate that hippocampal expression of the BDNF. And so what we also see clinically is that you see a reduction in anxiety and a normalization of that BDNF concentrations. And then there's another neurotransmitter called GABA, which typically plays a big role. We think of it as like helping with sleep. It's more of an inhibitory neurotransmitter, but it also so it's also showing that if we have dysfunction of that GABA, that it's linked to anxiety and depression. And what they've shown is that if we take some of those psychobiotics will help you to metabolize glutamate, which is able to produce GABA. So it's so interesting because these microbes within our gut are able to make and produce these neuroactive amino acids, which help your body to be able to make your neurotransmitters, which is going to help that brain to function better. So it's pretty amazing what our bodies are able to do. And then we see it in terms of a brain, like the brain function. So when we're taking when you're taking any of those psychobiotics, it helps to decrease inflammation in the brain. It's been shown to improve cognitive function, memory, reduced anxiety. So it's helping overall, all the studies are showing that these psychobiotics are helping our brains to function better. And we see that again in terms of anxiety. We see that a number of these studies are just showing that if you take these psychobiotics, that it's helping to reduce anxiety in a number of different pathways. And again, like the research is like very convincing and very shows it very well that if we supplement with the probiotics or the psychobiotics, as they're often called in the literature, is that we're seeing a decrease in terms of anxiety and depression. Now, this is something I think is really important in terms of the psychobiotics in pregnancy, because I think that a lot of people are suffering from depression, anxiety, postpartum. And what they've shown is that if they supplement with probiotics throughout pregnancy, that we see an actual reduction in terms of depression and anxiety postpartum. So I think that that's really significant that we get women onto probiotics. And then I'll go through this really quickly, but this would be like how I approach things in terms of taking care of the digestive tract and how we heal up the system. So you first of all want to decrease the inflammation. You need to put out the fire. You need to work on healing up the lining of the digestive tract. You want to build a healthy microbiome. We need to make sure that the pathways of detoxification are working well, and then we want to reestablish that proper function of the immune system. So this is my approach, and often I will overlap a lot of what we're doing. So we need to decrease inflammation, and to me, inflammation can be coming from 6 different places. It can be from food intolerances, immune challenges, heavy metals, environmental toxins, physical stressors, emotional conflicts. And then we want to decrease inflammatory foods. And this is where I a little bit of conflict with what Malcolm and Denny were saying yesterday. But what I see in my clinic is that these are major inflammatory foods is gluten, cow's dairy, sugar, and industrial oils. And then we can have exposure to different things like environmental toxins, heavy metals, infectious agents. We can have mechanical stressors as well as emotional stressors. So we want to identify all of those. And to me, diet, like we have to adjust diet in order to heal the gut. If we're not changing up diet, it's really hard. If we're still eating a lot of inflammatory foods, it's really hard for us to actually balance out the gut. And then we have to heal up the lining of the digestive tract. And I think that this also can impede in terms of what we're saying. But to me, we need to have some healthy fats because the lining of our digestive tract is made with fats. And then some of the supplements that we could use, one of the supplements we could use would be like NAG, which would help to heal up the tight junctions of the gut. And then we got to build that microbiome. And this is all the stuff that you're going to learn this week. You're going to learn how to build up this microbiome. And what you want to be doing is like the microbiome is so central to how our bodies function. It's going to be protective of the lining of our digestive tract. When you protect the lining of our digestive tract, we're also helping with proper brain function as well as every other system of our body. And one of the ways we can do that is by taking a high quality probiotic, but you can also be incorporating some of those natural probiotics. And that's where fermented foods comes in. And that's, there's a range of different fermented foods, but this is another way to feed our gut and to help build up a healthy gut flora. And then the other thing that you want to incorporate is something called prebiotics. And prebiotics are foods for the healthy bacteria. So it helps those healthy bacteria to repopulate and grow. And a lot of those prebiotics are from fibers from the vegetables that we're eating. So you want to just make sure that you're incorporating those prebiotics into our diet to make sure that we can grow more of that healthy bacteria in our gut. And then we want to support the organs of detoxification. So you want to support the liver, the kidneys, the colon, the lymphatic system, the glymphatic system, because we want to make sure that toxic loads are effectively moving out of the body. And then we want to help, because what can often happen is that when you have a compromised gut wall, then you can have disruption in terms of our immune system. So that immune system that's just on the other side of that gut wall. And so what we have to do after we've healed up the lining of the digestive tract, reestablish that microbiome, helps the body to move toxic loads out, then we have to actually re-educate the immune system to be able to function properly or appropriately. Okay, and really, I see this as a huge paradigm shift, especially in terms of neuroscience, in terms of psychology. It's realizing that there is a huge gut-brain microbiome connection. We have that gut-brain microbiome axis, and we can be using psychobiotics in order to affect that system. And so we can be helping with a range of mental health issues as well as helping with proper brain function. So everything from depression, anxiety, autism, Parkinson's disease can all be affected by understanding that microbiome gut-brain axis. And what you need to realize is that if we want to effectively treat mental health and brain health, we need to learn to balance that microbiome. All right, so thank you so much. I went a little bit over time, but hopefully we'll still have some time for questions. And if you need to reach me, this is all my information here. Okay.
All right. Yeah. Thank you so much. Yeah. No worries about going over time. That was a major deep dive, and cool. We did get lots of questions.
We got lots of questions. Okay.
Dive into that.
Hopefully I'm able to answer them.
All right. Yeah. And appreciate Ken dropping all kinds of great articles throughout the talk. So we will be sharing that with all the links that I'll send out tomorrow along with the recording. So, okay. Tracy Reed asks, have you seen any research on TMAO and brain health?
TMAO. Oh, okay. I know. I'm trying to. So I can't think of it off the top of my head, but I think that there's been some research in terms of. I feel like I talked about it on one of my last talks that I gave here, and that because we talked about it in terms of like the genetic testing, and if you did the genetic testing, you may show that you're not breaking down some of those foods. But I don't know the research off the top of my head, so I can't answer that exclusively right now.
Yeah, all good. All good. Okay, so here's one from Janet. She says, given the gut-brain connection, is it possible to have tight junctions in the gut, but impaired junctions in the brain?
There probably is. I can think of one example.
Sure.
Because one example would be, for example, you have done a good job in terms of taking care of your gut health, but if we injected a toxin into the bloodstream, then we could have damage to the tight junctions of the blood-brain barrier.
All right. All right. We figured we'd come over here and
Okay. So you're in the picture too?
Yeah, we're in the picture
Okay.
too. All right, here we go.
Okay.
Okay, excellent. Why don't you read the next one there, Denis?
Okay, well, this was a question.
Oh, I'm on here too.
Yeah, this was actually a question that came up personally for me, and I'm just wondering, like, are there ways that you can like really find out the health of your own microbiome? Like, can you go and I understand you were talking about how you can see in your blood
Yeah.
if you've got stuff and like leaking out of your gut barrier, right? But
So I'll tell you. So one of the ways that we can see, like when I'm doing some of the testing that I do in my office, I do something called dark field microscopy. So it's a prick of the fingertip. We look at live blood cells underneath the microscope. And when we're doing that, I can see if you're showing some signs of leaky gut. Because what we can see is usually some fat globules. So you can see that some of the food particles have made their way into the blood. So that would be a sign that there'd be a leaky gut picture. But there's also other tests. One of the tests I run in my clinic is something called the GI map. And it's a stool test. And with that stool test, you can find out about the composition of your gut flora. And yeah, so and it actually does like the DNA of all of those different microbes. And so it's a very complete test and gives you lots of information.
well, Malcolm, do you think we should check ourselves out? Should we see what's going on in there? But yeah, okay, we got all sorts of really good questions coming from the audience.
Well, you have a story about you have a testimony that you actually got your microbes tested by someone here locally.
Yeah, well, yeah, this was a practitioner of it was some sort of device called like the biofeedback machine.
Okay, yeah.
And he said he had tested dozens and dozens of people.
Yeah.
And there's always it's a device that reads your vibration.
Yeah, frequencies, yeah.
Apparently of all the people he had done this treatment on, I was the first one that had a green light, like
okay.
that my gut flora was intact. He was surprised to see.
Yeah.
But I've been
because like I'm going to say that the most people have a gut that is not in, like gut flora that's not in balance.
Yeah.
In general.
Interesting. Okay, well let's keep going here.
There was a question. Margot asked, "Can you describe what is a proteolytic enzyme?"
Oh yeah. So a proteolytic enzyme. Sorry, I went quickly through a lot of my slides. So a proteolytic enzyme is an enzyme. Our bodies actually naturally produce those enzymes, and so if we take them with our food, they'll help to break down the foods we're eating. But if you take them between meals, it helps to break down inflammatory factors, including things like cancer cells. So proteolytic enzymes, you want to just make sure that you're taking them away from meals. And so how we set this one up with breaking down, like if there's amyloid plaques showing up, then what you want to do is you want to take those proteolytic enzymes before you go to bed so that they can break them down during your deep sleep.
Okay. Yeah, someone is asking to stop the screen share so we can see you, but you guys can see us, right? Yeah. Okay, perfect. I think, yeah, just all
like they see this.
Yeah.
Okay.
All right.
So here's the next question here. Yeah, this is from Diana, and I think she just she's wondering, is Psychobiotic only a specific strain of probiotic? She's just a little confused.
I know. And so the more I dug into this research, what I realized was that basically, honestly, psychobiotics are probiotics. And that they've just named them in the research as psychobiotics because these are bacteria that specifically affect the brain. But like when you're looking at all the strains, those are all just they're all just different types of probiotics. And for sure, there's some that I would say there's some that have been studied more and been shown to affect the brain a lot more than other strains. But in general, they're probiotics.
Okay, so here's a question from Debbie. Which probiotic supplements do you personally recommend for people if they're looking to actually do some supplementation?
Like I have some high quality ones that I have in my clinic. So I just work with professional brand products. So we know that they're really high quality. So yeah, I would say that there's specific ones that I use and that we have success with treating. Yeah.
Yeah, if you don't want to you don't want to scarf your sauerkraut down, right?
Yeah. But I think there's a place for both of them.
Yeah. So here's another really good question coming from Chantal. As far as prebiotics go, for vegetables, do cooked vegetables work as prebiotics as well?
They can, because what they are is like you need, like it's actually like it's the fibers within those vegetables that help to feed the healthy bacteria. So so you'll still have access, even when they're cooked, you'll still have access to some of those fibers, which can still act as those prebiotics.
Amazing. Okay, so I have another question for you personally, and this comes from, well, it's amazing watching your presentation and just seeing how intricately interconnected all these parts of the body are.
Yeah.
Your gut to the lymph to your brain.
Yeah.
And I was wondering what you thought about the connection between vitamin D and happiness. And apparently, what I was reading, it's created by the microbes on our skin.
Yeah.
Making, I don't know what they do, but they multiply. They are squirting these juices. I don't know exactly what's going on our skin, but
yeah,
I've heard one theory that one of the reasons we've have so much depression is that we're just being too hygienic. We're killing our flora, not only inside but outside as well.
Yeah.
I was wondering if you could talk a little bit about that.
I think you've asked a few different questions in there. So I think that well, one of the things is that we are definitely overusing, especially with what's going on in the world, we're overusing like antibacterial soaps and everything, and we do have microbes on our skin, and we are killing them off by using any of these hand sanitizers and antimicrobial soaps. So that's definitely something that's not working well for our microbiomes. And then in terms of vitamin D, like vitamin D is actually like a hormone, right? And there is a reaction that happens within our skin, and we need to have exposure from the sun in order for us to make vitamin D. And then vitamin D does get made like below the skin surface. But we definitely need a lot of those. We need a lot of those different hormonal factors in order to make that vitamin D. Potentially, I'd have to look into it more, but potentially there's some that come from the gut that will go into the bloodstream and have an effect in terms of how we make that vitamin D. But it's probably complex, but more beautifully orchestrated.
Are we going to be seeing sauerkraut juice in all the hand sanitizer bottles soon? Well, we personally really appreciate your perspective on this, Dr. Melina. Like the science does speak to a lot of people. The science speaks for itself right now. This is so important to be sharing this information. Yeah, it's funny to come, you know, from a perspective. I'm just like kind of a foodie, but yeah, this stuff is blowing my mind, literally. I think so.
All right.
We got some good comments. Love the science.
Yes, right on. Yeah, and Tracy had just added to a comment previously, concussion will open junctions in the blood-brain barrier.
Yeah.
Added that to the conversation earlier.
Yeah.
So, all right. Okay. Well, here we are. We're at the top of the hour.
Okay.
Just past 9 o'clock. So thank you again to our presenters, Melina Roberts and Megan Barefoot. And thank you guys for tuning in live. Thank you if you're watching the replay. We're stoked to see you on the next video tomorrow night, same time, same place.
We're gonna share all of how to get a hold of Dr. Melina with you guys and all of her cool social media stuff.
All right.
Looking forward to day three. Day 3 of the Ferment Fest tomorrow is involving fizzy, effervescent beverages. So we have our first presentation is all about Jun. That is the kombucha that eats honey and has some amazing enzymatic benefits, real fascinating beverage. So we have Azur Walker presenting to us how to make Jun. And then, we have Luca. We have Luca Simons teaching how to make water kefir. So that's another really interesting culture. We'll, I guess we got a funny joke. I don't know. Maybe we'll save it for tomorrow.
Okay. We'll save it for tomorrow. Yeah.
His dad jokes.
Yeah. More dad jokes. Literally, you get on the car and he's like, oh, my dad just told me a joke. So yeah, it's a little dad joke we'll have for you tomorrow night. And I'll be back-to-back recipes and learning from two masters in the kitchen. So looking forward to you guys joining us tomorrow night. Have a great night, and we'll see you tomorrow. Bye for now. All right.